Hi there, today I'm going to talk about the risk of getting COVID versus the risk of getting a vaccine. So my name's Nathan from the COVID Recovery Initiative, and today you're going to basically find out what the risks and benefits are. Now, we know that the death rates that come with COVID are really significant. So we're looking at between the ages of less than 17, there's 20 deaths per million people. 18 to 49, we have 500 deaths per million people. 49 to 65 is 6,000 deaths per million people. But once we go above that to ages above 65, it actually goes up to 90,000 deaths per million people, which is really significant. So the chances of dying COVID are very real, but also the chances of long-term disability are also very real as well. But we'll talk about that another time. Now, the chances of having an adverse effect in a vaccine, so specifically today with the AstraZeneca vaccine, is about 1 or 4 to 6 people in a million people. So it's quite low. Now, this will change with different age populations, but we need to start to think about, well, if we're having a vaccine, what does the risk have to be to outweigh the benefit? So we know that less people actually die within the younger age groups. So it would be about 1 in 50,000 people, or 1 in 50,000 adverse effects to make it worthwhile administering, wrong word, in that population. But this is where it gets really interesting. As we go higher, and people between 18 and 49, which I think are the people that go, I'll be fine and things will move forward, that it's about a 1 in 2,000 risk of serious adverse effect. And that means that if we had that, which we know it's not, it's like 1 in 250,000 for AstraZeneca, that if it was 1 in 2,000, we wouldn't actually do that. But the risk compared to dying is that significant that it's really important. Now, from here, it's a 1 in 160 risk factor for those aged 50 to 65, but then it's 1 in 11 for when we look at those people aged above 65. So this means that if the vaccine in 11 people had an adverse reaction, then they'd probably go, 1 in 12, we can put up with that because it's going to have less death or help people live longer or stay alive really through having that vaccine. Now, if we look at the numbers and we say 1 in 11, 1 in 2,000, if we even want to go to the 18 to 45 population, then this is really big. You know, the adverse effects are much less. And what we're doing as well is not only just protecting ourselves, but we're protecting those vulnerable people in the community. So that's not just the people that are higher risk factors of age above 65, but for those front workers, those people that are actually in hospitals. They're working every day. They don't have a choice with this. And then there's also the other people that may have be immune compromised, that can't do this. They might have a genetic heart defect for when they're born. We need to keep those people in mind. So having the vaccine is much better than getting COVID. It is much less likely and means you're much, much less likely to die. So hopefully that's been helpful. And there's a lot of numbers in there. But if you've got any questions, please put them below or get in touch with us. Thank you.